So now the question arises, how to monitor therapy? Well, it is possible to measure the concentration of antibiotics in the serum or at the site of infection, for example, in the cerebrospinal fluid for meningitis. Now, this may be necessary due to a few factors. First up, it is necessary to ensure that there are adequate therapeutic concentrations at the site of infection. Secondly, we have to reduce the risk of toxicity, which is important where the therapeutic index is low. For example, in serum levels of aminoglycosides should be measured in serum taken just before and 1 hour after the intravenous or intramuscular dosage, which actually allows the dose to be adjusted accordingly to normograms. And there is careful adherence to the guidelines. For example, for a high peak, the dose may be reduced, or for a high trough, the level of medication is given less frequently. Now, monitoring is also necessary to assist in the management of an infection with intermediate susceptibility. That is, if the inhibition of the organism occurs only at the high antibiotic concentrations, it is important to ensure sufficient concentrations are found at the site of infection. For example, in Pseudomonas meningitis, antibiotic concentrations should be measured in the cerebrospinal fluid. Now, the study of the pharmacokinetics of the drug is also necessary. For example, in the treatment plans that are based on knowing the absorption, distribution, and the protein binding of drugs. And especially in the new development of new antibiotics, the way in which the new agent is absorbed and then distributed throughout the body is studied very carefully by careful sampling. So these were all the reasons why monitoring therapy is super important in the case of antibiotics.